No, he's disinfecting in the body.
The 2014 Ebola outbreak in West Africa was the deadliest in history, and healthcare specialists are working to prevent the next one.
Countries might officially be declared Ebola-free, but challenges remain. And for those reasons, the work of agencies like the Centers for Disease Control and Prevention continues.
The CDC's Dr. Barb Marston.
The virus can hang around in the body of people who have survived Ebola and can then be spread to other people and start new outbreaks. In fact, there have been 7 clusters of Ebola since the epidemic was controlled, 3 in Liberia, 3 in Sierra Leone, and 1 that started in Guinea.
Countries are better prepared now, says CDC's Liberia country director, Dr. Desmond Williams.
In March, we had a case again in a remote part in Guinea, and a case, one of the contacts from that particular family moved down to the capital city of Liberia, Monrovia. But because the 2 governments were ready this time, we were able to limit that outbreak to 13 infected people and 9 people dead.
Our biggest focus in all 3 countries is on activities related to surveillance and laboratory and building human capacity. Right now we have a team of about between 50 and 60. That's counting people who are Americans that are permanently stationed in the 3 countries, plus some locally employed staff and also some from staff from the offices here at CDC that are traveling there temporarily to assist.
Although the epidemic is over, hospitals in the U.S. are not letting down their guard. Dr. Colleen Kraft is with Emory University Hospital in Atlanta, which treated 4 U.S. Ebola patients. She says today her work is all Ebola related.
Nebraska, Emory, and Bellevue all are in one group called NETEC, which is the National Ebola Training and Education Center. And essentially we are tasked with training, educating, and exercising and visiting every hospital in the United States that is preparing to take care of a patient with Ebola virus.
Affected countries and organizations around the world dedicated unprecedented resources to combat the Ebola epidemic. With preparation, surveillance, and community cooperation, they hope that when the next Ebola outbreak comes, they can contain and reduce the disease's toll. Mariama Diallo for VOA News, Atlanta.